So I chose dental hygiene because I had a great experience when I was a kid.
Going to the dentist all the time, I really had, an overall positive experience, and the hygienist working at my dentist's office, was really nice and seemed like something I could really do.
So I've always been really interested in the dental field. Like as a kid, I always enjoyed going to the dentist, and I always liked the idea of helping people and getting to know them in that way and working in the medical field.
I really wanted to do something to help others. Didn't know quite what that was yet. I started off doing nursing at Texas State, but then quickly found out that I wanted to do dental hygiene. So I really just loved COM. I loved the faculty, I loved the staff, I loved everything about it. I loved how close it was for me. And so once I decided to apply here, I thankfully got in. And so I just really wanted to be able to help people with their smiles and making them feel confident.
Growing up, I had to have a lot of work done on my teeth. And so that just brought me in and out of a lot of dental offices and orthodontic offices. And so when I got older, I became a dental assistant. After working on the restorative side of dentistry, I realized I would love to be part of the preventative side of dentistry. So just preventing patients from having to have cavities and having to have root canals or whatnot. And so that's what got me started.
I've always had an interest for the dental field, and I went off and worked as a dental assistant, loved it. And I started doing my prereqs for hygiene school. I applied last year, and thankfully I got accepted, and here we are.
I specifically picked College of the Mainland because I've been a student here before and I really enjoyed my experience. I love the campus and I've loved every teacher that I've had.
I just felt like being part of the Texas City, I grew up there, so why not come here? It's where I live, so I think it represented, who I was to come here, and luckily I got in, so I'm pretty grateful for that.
Coming from a dental background previously, I was already used to just having that face-to-face interaction with patients, but being in dental hygiene, this program, it's taught me a lot more about how to communicate specific things, whether it's oral hygiene or why we do oral cancer screenings for these patients, and just to explain to them the benefits of each step that we take.
Caring for patients to me means giving them more agency over their oral health. There's a lot of people who are very insecure about either the way that their mouth looks, or they might have perio or gingivitis, and they're really insecure about that. And a lot of that comes down to people not having any sort of education about how to take care of their teeth.
I've had one kind of patient experience so far this semester where I really was able to change his oral habits. Even though it's just one patient so far, it feels great to know that I've helped somebody, in this field, and I can't wait to help more, once I graduate.
I love the thought of being able to help people. It really does mean a lot, especially in this field.
I do want to, be an advocate for helping people, be more aware of their health.
I really care about the education part when it comes to treating my patients. I want to not only give them a good experience in the clinic, but also give them education that they can put towards their oral health care routine at home, so that they are able to take care of themselves in addition to me taking care of them.
You kind of have a direct line of, how you're positively impacting that patient's oral health care journey. So you get that, one, you get that sense of satisfaction for you, and then two, you get a sense of satisfaction knowing that you're positively impacting that person.
I think it's just super sad that some people live in a world where they are in pain, can't eat the food that they love, hate their smile, and I want to be a part of changing that.
I just want to inspire another little brown girl like me. That's why I chose dental hygiene.
A big part of confidence is your smile, and so helping people feel more comfortable in themselves and with their smiles really boosts their confidence, and that's really empowering, I guess, for me and also for them.
You can't build a house without a foundation.
My name is Ryan Blair.
My name is Ashlyn Robertson. My name is Peyton Gore.
My name is Carrie Schrampy.
My name is Markel Simon.
My name is Gabby.
My name is Denise.
My name is Lainey Childs.
Is that good?
Yeah, that was good. That was perfect.